The following segment contains sponsored content. The opinions and views expressed belong to its sponsors and not those of Nexstar Media Incorporated, this station, or their affiliates or employees. Now, time for a break with Central Illinois' own Gretchen Wirtz.
Welcome back to Central Illinois Newsday. I'm Gretchen Wirtz, and today we're sitting up straight here, and we are getting healthy here with Todd Clanahan with the Clanahan Wellness Center. And yes, I am trying to sit up straight with you here and everything. Of course, the Clanahan Wellness Center does a lot of different things, but today we're going to talk a little bit about the difference between traction and compression, right? And that's
Correct.
something new you've been doing, the compression?
Yes, called spinal decompression.
Spinal decompression.
And a lot of times we talk about the difference between spinal decompression, using that as an option versus spinal surgery or steroid injections or of course opioids, which is a big epidemic in this world.
Right.
So this is all about getting the message out there, telling people that there is another option.
There's another option,
right?
something else we could try. Okay.
But today I wanted to talk about a question I get a lot in my office, because a lot of my patients think traction and spinal decompression are the same thing.
Okay.
And they're totally different animals.
Okay.
They've been using traction for many, many years. And spinal decompression really came on the scene about real early 2000s.
Okay.
The difference between the two is traction is just a linear pull. Basically, all you're doing is pulling the spine.
Okay.
And then you're just holding it.
Okay.
Well, the problem with that, well, the difference between that and spinal decompression is spinal decompression, you're actually doing more of a pumping action with the spine.
Okay.
So you're not only pulling it, you're relaxing it, pulling it, relaxing it.
Okay. So that's the difference. Okay.
So the benefit of doing that versus traction is, especially if you have the expensive decompression tables like we have, where you can use technology to your advantage. So the tables we have are all computerized to where you can adjust the angle of the pull.
Okay.
So you can target the patient's worst disc or the disc that's causing them the problems.
Okay.
So you can target it, you can angle it specifically for the disc. You can adjust the pressure, the weight of the pull.
Okay.
And the fact that it's pulling and relaxing is actually causing a vacuum effect inside the disc, which actually pulls the gelatinous material that's inside your disc, which basically your disc, if you think about it in layman's terms, like a jelly donut.
Okay.
So you have jelly in the middle and you have a hard cartilage on the outside. So that jelly tries to break out of the donut, right, for whatever reason, injury, bad posture, degeneration. And when you do the pumping action, it pulls the gelatinous jelly into the center of the disc again.
Okay.
Also, because it oscillates and pumps the disc, it actually creates water and nutrients and oxygen and blood coming into the disc that actually can make the disc heal itself.
Okay. Okay.
The disc is an active tissue, so it can actually heal itself if it's under the right conditions, which is basically what spinal decompression does.
Okay.
Traction also, if you pull too much, then you're going to cause the spinal musculature, the muscles that wrap around your spine, you're going to cause them to contract. So if you pull too much and your muscles contract, then it's not really doing what it needs to do, okay? Because your muscles are fighting what the machine does.
Huh.
Where our advanced machines these days, with the smart computers, right? They feel that tension, they feel the contraction of your muscles, and if the machine feels that, it will lessen the pull. So it will do that automatically without you even knowing about it.
Well, this is fascinating, and I know there is so much more we could talk about this, but we are out of time. But that's amazing, and you had me a jelly donut, and that did explain it pretty well. That was good. I like that, and I think that people will relate to that. Jeff, definitely check them out online at ClanahanWellnessCenter.com. Give them a call at 353-3300, and we're going to have you back again because we've got a lot more to talk about.
Absolutely.
All right, Todd, thank you so much for joining us.
Thank you.
More coming up. Keep it right here.
The preceding segment contains sponsored content. The opinions and views expressed belong to its sponsors and not those of Nexstar Media Incorporated, this station, or their affiliates or employees.